Hi, welcome to the Health Exchange. I'm your host, Kimberley King, and today's show is going to be about ticks, tick prevention, and what's happening up on Beacon Hill. And with us today is Representative Cantwell. Welcome to the show, Jim.
Kimberly, thank you so very much for having me.
Would you mind sharing with us today your personal experience on tick-borne diseases and how you came to know that you had Lyme disease?
Absolutely. One of the lessons for my personal history is that there are so many precautions we should take, and even someone who in my position, knew about some of the dangers of tick-borne illnesses, but still had a bite. So some 3 years ago, I was camping with my son and a number of scouts. My son's on his way to be an Eagle Scout sometime this year. And despite the fact that I was always the person that would be spraying some of the boys, making sure that they would have off and have things that could hopefully prevent both mosquitoes and ticks and others, I myself was bitten. And I was somewhat fortunate because there's one of the symptoms that people should be aware of if they have a bite. One symptom is you can have what looks like a bullseye. There's an area where the bite takes place, and then there'll be a circular area that's all very red. I didn't notice it was in the back of my leg. And for me, a first part of our discussion here today is just that people should realize symptoms that seem to be maybe the flu, particularly if it's not flu season, people should be aware can be a sign that you've been bitten by a tick. What I had was a temperature that was 102.9 and rising. I had tremendous chills through all. My joints were really pained. It's almost like an arthritic feeling. But it wasn't until I was being affected neurologically, forgetting where I was driving one time with my son and his friends, that I realized this is serious. So I'd gone to the hospital. Fortunately, at the emergency room at South Shore Hospital, they immediately saw not only the symptoms, but saw the bullseye, and I was given an intravenous antibiotic right there and then to try to address the illness. But the first part of the message is, I guess, of symptoms that people can see, and I know the second part you're going to talk about would be...
Yes, so, prevention,
yes.
And you mentioned using a repellent.
Right.
And coming from my background and my audience knowing that DEET has to be a 20% or above, a picaridin needs to be a 15% or above to be effective for ticks. And when it comes to prevention, there's so many mixed messages out there when it comes to our EPA-registered products versus what's called a B25 or exempt product that don't have a labeling law to them, and really give a false sense of security to the public using it. Do you have any advice for us on how to do it, or how the legislator may or may not be handling it for the future?
Sure. So I think the first thing is doing what you do right now is to be well educated. That when we're talking of ways to prevent a bite, that we do have the Federal Food and Drug Administration, that when there are labels that are on different products, it's not regulated by the state government, because there'd be difficulty with interstate commerce. You know, if each state had a different labeling requirement, that would be difficult. But I do think people should do what you've done, is get educated, watching your program, going online to say, what are the products that could have that 20% or greater DEET, so that they know that it's effective. Making sure that when you're going out, wearing light colored clothing so you can be able to pick up if a tick happens to get onto you. Making sure in our backyards there are certain plants and certain things that attract deer. You know, so you should try to deer-proof your backyard. But realize that deer, even though there's the misnomer that ticks are deer ticks, really a lot of these things come from mice. Most of it, actually. So there are things you can buy at Home Depot and that you can get at any other, where the little cotton balls, there's a little treatment that you can have. Mice go in, they eat them, bring them back home, and it gets, for all of them, it can inoculate them from carrying these types of ticks. So those are things that I think for prevention, absolutely get to be educated as you are about what is effective when you're going out to spray yourself. As I stress to people all the time, you know, here in Whitman, and you're from Halifax, I'm from Marshfield, we have so many beautiful outdoor places to recreate and have fun in that. We want people to be very comfortable to go outdoors and enjoy the great outdoors. But as we do that, we want to just make sure we take precautions so that you don't have, as our state town and county treasurer, Tom O'Brien, says, don't let one tick change your life. Don't let one bite change your life.
Absolutely. I couldn't agree more. And I know a lot of people I've spoken to are terrified of repellents and other things. And I couldn't stress more to anybody, if you follow the label on it and follow the instructions, you're going to be safe. One of the biggest mistakes I've known when I do seminars is, how do you spray? And everybody's like, we spray the can like this around your head, and that's just not the proper way. You spray it in your hands or your face so you don't ingest it.
Sure.
And a lot of the products you'll see less of the stigma and the poor reviews on them, because we're following the recommendations of the product.
And as you know, because for a number of them, you put them on your clothing. So it's the idea of making sure in areas that and I always mispronounce it, Prethrin, but now when we go out with the Scouts, doing that in almost all of their uniforms. So those types of things. So that's also prevention, though. So we're talking about what some of the symptoms can be, talking about some of the individual prevention. Then for other categories, as you and I talked offline, just making sure that the third thing is for our doctors, to make sure that they're aware that if someone comes to their primary physician or to the hospital and they have these symptoms, one of the difficulties is, you and I talked off air, that there are some 300,000 people a year who are known to be infected with Lyme disease. But most experts, and the CDC says, we think only maybe 1 in 4 cases, maybe even that could be 1 in 10 cases are actually reported. So the reality is we could have over 1 million people, well over 1 million people, who are infected with Lyme disease or tick-borne illness every year. Most of them are in New England, in our region. So the other part of what you and I were discussing that we need to spend so much time on is making sure, educating our doctors so that they're aware of what these symptoms are. People oftentimes are misdiagnosed, and that kind of delay in treatment can be something that would be leading to more difficulties health-wise.
And I know when we were speaking, you were speaking of the campaign and the new push to have education out there.
Right.
What can the public be excited for 2017? For education to their doctors and education for themselves.
Right. So one of the things, that the first part for education for the general public is, you would know, since you've been one of the leaders here, we spend $10 million a year out of the Massachusetts state budget for mosquito control issues. Probably still should be more, but there is a set number of people understand the importance of being able to combat mosquitoes. We spend very little. It's in the tens of thousands of dollars, if that. It's about $10,000 for tick-related issues, and there are little brochures that are put together, and those can be sent out. People can request them. Doctors can request them. So, but folks don't know that. So that's what we were doing in the budget last year, is trying to get a pretty small amount, as a state budget goes, is $500,000 that would be for a public education campaign. That we would have materials that could be sent to every doctor. Trying to make sure that when doctors have regular continuing education, to make sure that this now, it's so prevalent, people throw the term around too often about saying something is a public health crisis, but for these numbers that we're seeing, it certainly is a tremendous concern, so that we want to make sure our doctors are well aware of what the symptoms are. And by the way, one thing we're trying to educate doctors is to know the law that we just passed last year that was combating insurance executives. That we want to make sure we empower our doctors. Once they make a correct diagnosis that someone has a tick-borne illness, we don't want to artificially handcuff them with their treatment. So the controversy that we addressed last year was saying, if a doctor finds, if and only if a doctor goes through and finds a person has a tick-borne illness that they want to treat, they used to be only allowed to do 2 rounds of antibiotic treatments. We're now allowing the doctors at their discretion to be able to do more until the person's illness is addressed.
And that is so wonderful, and it's so fantastic for the public to know too, and not to be afraid of the cost associated with it. And I couldn't commend the legislator more on doing that, and commend the legislator for overriding the veto that the governor had on that legislation.
Sure.
It's wonderful.
And I think, from the governor's point of view, I think the concern, there is, I think his staff was saying we want to make sure that people are diagnosed correctly and that we aren't just giving out antibiotics left and right, because if people are given too many without the proper regimen, you could cause some other difficulties. You could build up superbugs, is the worry. But for here, we are very careful of how we strictly wrote this legislation to make sure that we want to empower doctors to do the right thing to protect the public's health. And that's the additional thing, as you and I talked about, is making sure that an individual who believes they've been bitten know to go into be educated through your program and otherwise to be asking for these tests. There are 3 tests that can be done looking for, 3 different things that they should be testing for when they're looking for Lyme disease. It's not just one strain. And so you can get false positives. The first time going in, sometimes it doesn't even show up for the first 7 to 14 days. So people need to realize if they're seeing these symptoms, getting very arthritic feeling, or in my case, the neurological. Some folks get Bell's palsy, where a whole side of a face can almost look like they've had a stroke.
Yes.
For people to make sure that they can be well educated, we already went through all the prevention, but now is if they do unfortunately have a bite, that they know how to be able to advocate for themselves with a doctor to get proper treatment.
Yes, and with all the tick-borne illnesses on the rise in Mass and the newly discovered diseases in Mass, it is so important to advocate for yourself with your medical professional. And if your primary is giving you a hard time, would you recommend them getting the second opinion or going to the ER, where the ER is just they have the equipment there, they know to do, when the specialists in the same building where you wouldn't be running out or having testing shipped off to outside labs?
I wouldn't suggest just rushing to the emergency room, because that one, for the individual person, they're going to find the way the healthcare system now is structured, and I think it's a wise way to structure it. You don't want to be going to the emergency room unless you really have to, because it's so much more costly. That the proper manner is going to your primary care physician, and you're absolutely right. If people say, I don't think my primary care physician really is doing it and doing the test, I would put things in writing to the doctors, by the way, saying this is what I believe I have and I want this test, because that at least raises the issue for a doctor to say, wow, this person is very well educated, they're very serious. But if their primary care physician just isn't someone that they feel is acting in their best interest, you're absolutely right. They should go for a second opinion and go in and then be asking for those tests to be done. And then, if and only then, if they continue to have these terrible symptoms and continue to have a great amount, that's when they make a decision about going to an emergency room. But just realizing that doing that is costly, and I say more to the individual. Most people, for your own health insurance, if you go not to your primary care, right to an emergency room, there's a large amount of money that you pay. It can be $500,000 just to go into the emergency room.
Yes, and for the future work, I know back in the early 80s they had taken a vaccine for Lyme off of the market.
That's right.
Because it wasn't very profitable and cost effective at the time.
Right.
For the future, will there be a new Lyme disease vaccine or a push to have prevention in the medical field as a prevention?
Yeah, I definitely think so. I think first, for the vaccine, you're absolutely right. There was a vaccine that had been produced, a country out of Belgium, that my committee have been reaching out to. And you're absolutely right. A main reason, in my view, why it was taken off, there were people that reported that they were having some side effects for it. And there was some litigation that was filed at that. But the larger issue was more, it was driven just by consumers, that there weren't enough people at the time who were interested. So it wasn't making the kind of funds that I think now, with all the awareness, I think that they could come back and they would be able to make a decent profit from it. And unfortunately, that's what a lot of the biological companies, that's what they think about. What we're working on independently from them, because we would like to have the vaccine, I've had meetings with Massachusetts Biologics and Children's Hospital that I brought them together to say, what are some other things where the vaccine, there's a patent, there's one company owns it, so there's a period of time we would have to wait. If they choose not to go forward, and I think that would be a mistake, what can we do? So we've had several meetings with our congressional folks as well, saying that the CDC, the Center for Disease Control, has some funding. Massachusetts legislature, we have some funding. What's exciting to report is that for UMass Medical Center, that they are trying to develop their own preventative shot. It's being, as I said, developed by Mass Biologics. It would be a shot that instead of, as your dad had to do several, I mean, your dad would have to have 3 different shots for the vaccine, that we found a lot of people don't do that. This would be a one shot that would be able to give people peace of mind that they would be inoculated. They could go out and enjoy the outdoors without having the risk of being infected. You could still be bitten, but not get the infection. What's exciting is they're working on developing that. I'm trying to champion an issue. We'll help fund that. And then the Commonwealth of Massachusetts will own that. That would be our impact. We then could actually make money from it. And we don't have the same kind of requirements of the company from Belgium. You know, we don't need it to make billions of dollars. We just want to make sure it's at least breaking even. So I'd like to come back with you at one point. It is right now, it's beyond the idea stage. They have developed in test tubes and the like. They have something that would be a ready-made shot that could prevent transmission of the disease for up to 6 months. We know it's an antibody that would kill the Lyme bacteria before they can get infected. I'm excited for it. We got to get some funds for it, and that's one of our goals for this upcoming budget.
That's fantastic news, and we'd love to have you back on to report on the success of it. And we've talked about personal experience and some prevention, and some of the future diseases, and the long-term treatments for Lyme disease. Is there, and I know that there's been past legislation amended to do more. Do you expect for there to be more amendments in the future and some more work, or would you like to extend on the successes of this legislation?
Sure. I think, for now, last year, Massachusetts, I'm always very proud to say Massachusetts seems to take a lead in so many different things around the country. And they say, there's a familiar phrase that people may hear, that they say state government's really the laboratory for government, because things in Washington don't necessarily happen that fast. So what we did last year absolutely was earth-shattering, I think, when it came to issues dealing with infectious disease, as far as mandating that an insurance company has to pay for these additional rounds of antibiotics. We're going to be a test case, so we're going to see how that is proceeding. I'm already having people call me who are saying, look, I had a copy of the legislation, I went and I'm being told my insurance company won't pay for it. So we still have to work out the issues and make sure that insurers are notified and are well schooled about they must pay for those. To expand upon that, what I'd like to see, we set up a Lyme Disease Commission back in 2012, and that commission did reporting about what other steps we could take. So we absolutely do have. The other thing I'm working on is the antibody. There's a Representative Carolyn Dykema who is leading the effort trying to empower our mosquito control boards, since we already have the infrastructure built to be dealing with mosquito control, to have those organizations also do tick control. You and I talked off air. It is very different that for mosquitoes, you can sometimes bring a truck up and do some aerial spraying and knock down and kill the mosquitoes, or you can go to an area where they're congregating, where they know larvae, where water may be there. You can be able to spray there. Ticks are tougher. They are year-round. They can be underneath. They can burrow underneath plants. They can burrow into the ground. So it would be more labor intensive. We think that the mosquito control boards would be the best ones to do that. So that's a recommendation of that special commission. So I think there is so much more work to be done, and look forward to continuing to make some advances, and we'll come back and talk about them maybe in a year's time as we have some great progress.
I couldn't agree more, and I'm very excited about it. And I'm sure the public would be very supportive for a form of vector control program. And labor intensive, but with so many of the new federal laws and mandates and the public health and environmental balance, the difficulty of tick surveillance.
Right.
Would we have to do away with nuisance control in Massachusetts if we were to spray for ticks, because it'd be extremely difficult to go and cloth every personal backyard for when the personal requests come back in?
Yeah,
but municipality-owned and state-owned property would be easier.
I'm not sure. I'm not exactly sure we're getting to it. But what I would say, what we have for the critical balance that we have right now, and that's what is on almost every issue. What I love about my job is trying to balance many competing interests. For here, we have a definite public health. And again, I don't want to use the term crisis, but it definitely is a public health concern of having so many more cases. So it's clear that we have to be taking some action. Developing an antibody is very, very important, so people are comfortable going out and about, letting people know how they would be able to safely use materials in their backyards that aren't going to harm their pets, won't harm drinking water, won't harm their plants, supposed to make them organic. So all of that. When it comes to the state balance, we for the mosquito control, typically they're well trained about how they have to balance their use of materials to knock down mosquitoes. That they get it. They know that they can't just indiscriminately be spraying. So I think giving those folks, empowering those people who already know the environmental regulations and are sworn to uphold them is a good place to be able to empower, give additional funds, and give the additional matter to try to knock down some of the ticks. Reality is, for tick-borne illness with climate change, the reality is with things that are migrating our manner, it's here probably to stay. So we got to learn how to manage. We have to learn, as we started the program, how to do public education, so people knock down the times that they may get exposed. Work on things that could be antibiotics if they do get a bite. Make sure our doctors know exactly what would happen if someone's bitten and what to look for, and then have the long-term treatment. So it's a 4-course of action. And in Massachusetts, we're leading the way, I think, on this issue.
I'd agree. Having come from an infectious disease background before hosting the show.
Sure.
And traveling to different states and working with multiple Department of Public Health. When I'm out of state, I hear, we love Massachusetts Department of Public Health.
Sure.
You guys are always #1. You guys have great legislators, So that message is the statement, is so
Sure.
true. And the message always resonates back that Mass is #1 when it comes to public health, and that everybody's a team player, and the public should be so grateful for that. If you've traveled to other states and see what they don't have.
Right. It's a helpful reminder, Kimberly, because we on so many issues where there are times when we know we want to do better. And on almost every issue we should. We should all strive to improve and be able to have better services, in this case public health services. But it's also good to know when we compare to others that we're doing a great job. So.
And when it comes, is there anything that the public could do to help your committee and the legislator meet their goals?
Sure. The best thing I would say, from no matter where people live and watching, get to know your state legislators. everybody is sworn. Well, we're sworn to uphold the Constitution, right? But we're sworn, and the people who run for office are all sincerely interested in trying to make a difference and helping. So if this is an issue, as I know you already know Tom Coulter, you already know Josh Cutler, you already know you said Angela D'Amelia. You've been working with all of them. But for folks, if they don't know. We all, as state representatives, all of us have regular office hours, so people should just go introduce yourself and say, this is something that's important to me, because government is often, it's a battle over competing interests. There's only so much money to do work. And I will tell you, when the state budget comes up, it'll be in April, and our Plymouth County delegation is always stand shoulder to shoulder on this, so that all of us say this is a priority. We work hard on it, but we have to convince other regions to be supportive too for funding. So anyone watching here, they should contact, depending on where they live, should make sure. I think here in Whitman would be Jeff Deal. You're in Halifax, which I'm not sure if you're at Tom Coulter's side or because Halifax used to be split. But that people, everyone watching there, you can call 617-722-2000. Let them know your hometown. They can connect you to your state rep or your state senator. Because I know Michael Brady is coming after me here today, who's a wonderful state senator who's worked very hard on this issue as well.
Yes. And remind the public to please take personal preventions, use a mosquito repellent that's EPA approved, and use it by label directions. Make sure that you follow the recommendations of maintaining your yard properly, to make sure that you know that your insurance companies are now mandated to cover your treatments, and to ensure that you speak to your doctor in length, give a written statement if you're unhappy, and get a second opinion, and not just rush off to the emergency room. And to follow the future works of the legislation going on, and to make sure that you keep your eye out for the public health materials that will be coming on. Pay attention and share the public health campaign messages. And grab, if you have siblings, grab an extra copy of the materials that are out and share with everybody. One person can help educate many. Is there anything else that you'd like to add,
No,
Representative
you did a
Cantwell?
fantastic summary. That great summation of all the major points. So thank you so much for having me come. I appreciate it. Thanks, Kimberly, and thanks to Kevin Tachi. I appreciate you both having me come by.
Thank you very much. We know you're a busy man, and it's been a pleasure to have you on your show.
It's great to see you.
And thank you for watching, and have a great day.
Hi, welcome to the Hanson Food Pantry. We're here located at 228 High Street in Hanson. We want to thank all our generous supporters that have got us into this beautiful building, and we ask now for your continued help in our day-to-day expenses to run the building, pay all the utilities, and support our truck. Besides donating material goods as far as groceries and other items, you can support us financially, and we can use that money to buy groceries at the Greater Boston Food Bank and other discount resources. There are other ways that you can help us, and one way is by volunteering. There are many different volunteer roles. Please call us or contact us in some way. Inquire about the ways you can volunteer. There are different times during the day, night, and weekends.